And it's time now for Sunday Housecall. I'm Marc.
Hello, and I'm Marthel Neville. Welcome. Joining us is Dr. David Samadi, Chairman and Professor of Urology at Lenox Hill Hospital and Chief of Robotic Surgery.
And Dr. Marc Siegel, Professor of Medicine at NYU's Langone Medical Center and also the author of The Inner Pulse, Unlocking the Secret Code of Sickness and Health. And that's what they do every Sunday right here on the program.
Absolutely.
Good to see you.
Great to see you.
Good to see you both. So let's get right to it because February is American Heart Month. And today we're going to talk about all the things you can do to show your heart a little love. It's very important. I mean, without the heart, we got nothing. So Dr. Samadi, what's first on the list?
Well, obviously, this is a very serious problem because it's a leading cause of death among men and women. We have 720,000 deaths and heart attacks as a result of this. So I'm glad that we're all wearing the red color as a bringing awareness in this situation. I always talk about mnemonics because I think it's always easy to remember exactly like what we're talking about. I think A, and I'll post this online on Twitter and Facebook, A is for like ask your doctor whether you need aspirin or not. Aspirin is a big topic and I'm going to ask Mark to make a comment. Who should be on aspirin and who should not? I think we're taking too many aspirin. I think a third of a country are suffering from metabolic syndrome. What exactly are we talking about? Metabolic syndrome is blood pressure, cholesterol, diabetes, and obesity, which leads to stroke and heart disease. Know your blood pressure. B stands for blood pressure, 3 times less than 120 over 80, less than that. C is for cholesterol. Do you know what your LDL bad cholesterol or your good cholesterol is? You should know this exactly like the way you know your age. That's important. I think diet is absolutely the key. We want you to stay away from what? Salt, sugar, fat. It's all obvious, but that's what you really need to do. E is for exercise. Are you really out there 3 times a week doing your exercise? F is for fiber. 3 sets of veggies and fruits, etc. G is for green. We've talked about the fact that if your plate, if you don't see the colors, especially green and red and for all the fruits and vegetables, you're in trouble. And finally, I'm going to ask Mark in this, which is H. It's habit. Now, this is a big part of this, and I want you to jump in, because when we talk about habits, we're talking about behaviors. And I just came back from Bermuda. We had a big heart foundation there, and what I realize is we as doctors, we're taking care of disease. We're disease care people. We're not healthcare people. And what do I mean by that? We need to change the behavior of people, Arthur. And that means that as a child, we need to educate our people about diabetes, about all of these fast foods, etc.
It's so hard. You know, Mark, I mean, it's so hard to talk about exercise. We talk about it every week. You don't always exercise. I walk a lot.
Yeah, because you live in New York City, but if you didn't live here, you probably wouldn't walk as much.
I know. I mean, you get in the car, go down to the mall, you walk down to the mall, and you don't. You know, it's hard for people.
And you're coming right to the heart of it, because at a time when deaths from heart disease is actually going down, obesity is going up, and diabetes is going up. So David's point about prevention, I mean, we're talking about 3 very tiny arteries on the heart. I wish you could see how small they are. They're so small. They get clogged. You got a problem. And it's easy to get them clogged. And so what can we do? Prevention is key. So patients come to see me. I want to know cholesterol, blood pressure, whether they're exercising. And as we've talked about on the show here, not just whether you're exercising, what are you doing when you're not exercising? Are you sitting on your duff in front of the television? Because that's a huge predictor of heart disease and stroke. So we want to know that cholesterol. We want to know how many fruit and vegetables you're eating. We've talked about our Mediterranean diet here. That's key. Whole grains, fruit and vegetables, and get rid of all of this processed food that have the sugars and the sugars and the salts in them. David asked a question about aspirin. I want to talk about that for a second. I have to identify you as being in a high-risk group, as we just said. High cholesterol, high blood pressure. You know, if I'm treating you for cholesterol and high blood pressure, and you have a family history of heart disease, and you're a smoker, number 1 risk of heart disease is a smoker, I might decide to put you on a baby aspirin a day. Of course, if you had a heart attack before, I definitely will. Now,
Dr. Mark, a lot of people don't know when they've had a heart attack. Is that true?
Absolutely. And I want to point that out, especially since it was Go Red for Women yesterday. And you 3 look beautiful with all your red today, by the way. But women especially don't necessarily know. We all know about that crushing chest pain, like an elephant sitting on your chest. But did you know you could have a heart attack just by being very fatigued or being nauseous or vomiting or or you're having a sensation in your left arm or your jaw or your neck or your left shoulder, that can be the only warning sign.
Or feeling like as if an elephant is sitting on your chest.
Right.
The pain is radiating to your left, and you have to call 911. But I want to get back to the same thing.
Guys,
because
one quick thing. If you think you are having a heart attack, should you pop an aspirin?
Well, I think at that point it may prevent some of the dissolving of the clots and prevent any of these clots to really go up.
I would say for sure, if you're having he mentioned this elephant on your chest, if you're having chest pain, chest pressure radiating down your left arm, you're short of breath and you're sweating, you pop an aspirin.
We have to get to the doctor immediately. Yeah. But again, let me just mention something. We keep talking about all of this stuff. But the question is whether we're getting through these people and they're really learning from this. And I really think that the only way that you're going to change the healthcare is to go back to when the kids are really 4 years old. We're looking for a lot of quick things. We're basically getting a lot of fast food. When you add sugar, salt, and fat, what do you get? You get your fast food. You get your processed food. And that's what we're eating. So unless we start educating and prevent the disease, yes, we can chop their legs for diabetes. Yes, we can give you Viagra for sexual dysfunction. Yes, we can do a lot of these things. But we're not going to make a difference unless we go for prevention and wellness. And that's a big message for this month, which is very different than what we've said every year. And I hope the message gets through.
Question for you on this. A man, is there a warning sign for men in men's health to say that they have heart disease in terms of their urologic function?
Well, this is actually a very, very important point that you're bringing up. The very first sign of heart attack in young men is sexual dysfunction, because the same arteries that are bringing the blood to the heart is bringing to the penile tissue or the sexual organ. And so when I see a 40-year-old obese, especially African American, who's at high risk of a cardiac, and he says, "Doc, my sex life is not the same," guess what I'm going to do? Instead of giving him Viagra, that's the whole point of this, is I send him to Marc and say, "Marc, get your EKG, get all the labs, make sure that this guy's not going to have a heart attack, and by losing weight and everything else, we can help him."
One final point we didn't cover, stress. I can't prove this to you, but I think stress increases your risk of heart disease.
And you
try yoga.
Oh,
not you,
good.
no, you, me.
Yeah.
Well, have you noticed how much he's smiling more since he's been sitting next to him?
It's not you, it's me, whatever. But no, I did know that the women are really unaware a lot of times that they're having heart attacks, because I did some work with Go Red for Women, the Harlem chapter, and I learned that from many of the survivors there.
Well, I congratulate you for also wearing the dress. I think it's certainly the symbolic one. It brings a lot of awareness, but there are a lot of great important points we just talked about that people need to pay attention.
Arthur, one point about women I want to just throw in here, which is after menopause, your estrogen is going down. You're not protected. And you were probably thinking you didn't have a risk of heart disease. Women after menopause are at great risk.
Wow. Right. Go Red for Women.
You want to have like a chat about
advice.
Why don't we just have something today on our Twitter? So let's talk about this. After this show, we welcome everyone to come to Twitter. Let's talk about this because it's a great topic.
Great advice. Time about